Hello, everyone. Thank you for joining our webinar today. We will get started soon. Good afternoon, everyone. Thank you for joining our webinar today titled Changing the Narrative, Black Maternal Health and Abortion Care, presented by the Black Mamas Matter Alliance. A few housekeeping items. Everyone is currently muted and will stay muted during the webinar. We will have time at the end for a few questions, so feel free to submit your questions in the chat box, and we will try our best to address them after the panel discussion. Please note that today's webinar is being recorded and will be made available on our website by the end of the week. So welcome. My name is Angela Doinsala Aina, and I'm the co-founder and executive director of the Black Mamas Matter Alliance. As the founders and leaders of the Black maternal health, rights, and justice movement, the Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals that work across the full spectrum of maternal and reproductive health. We operate at the national, state, and local levels and collaborate to advance policy, promote holistic maternity care, cultivate research, and uplift culture to advance maternal and reproductive health equity, rooted in birth and reproductive justice, respectful maternity care, and the human rights framework. Next slide. Of particular note, we use the phrase Black mamas to include a range of folks, from women and birthing people across the African diaspora to those who care for and mother our families and our communities, whether they have given birth or not. We stand in solidarity with all Black mamas. At BMMA, we approach our work through the goals of working to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes, cultivate research that leverages community knowledge and Black scholarship, advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas care, and shifting culture to dismantle negative narratives on Black motherhood and amplify the voices, leadership, and experiences of Black mamas. We know all too well the maternal health crisis in the United States, with the ratio of maternal mortality rising over the last few decades. And consequently, the impact is disproportionately affecting Black women and families. However, it is important to note that these deaths are preventable and that solutions require policy and healthcare systems change. Additionally, statistical data alone doesn't describe the full complexities of maternal mortality and health disparities in the United States. Fleshing out the historical context of present-day maternal inequities and reproductive injustices is key to addressing these issues. The regulation of Black women's reproductive decisions has been a central aspect of racial oppression in America. The institution of slavery in the US opened the door for all types of unjust medical experimentation on Black women's bodies, from experimental vaginal surgeries without anesthesia to stealing cervical cancer cells, all in the name of advancing science. Of note is that Black women have always organized, mobilized, and provided care to our communities. Such care work, like midwifery, has informed and shaped medicine, nursing, public health practice, and the maternal and child health systems of the United States. In regards to Black women's care work, their scholarship, and especially Black feminism and womanism, and their organizing leadership has created lasting legacies in the global reproductive health and rights social movements. Such efforts is in the coining of Reproductive Justice, in which Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy, the right to not have children, and to have access to the resources needed to carry out one's own reproductive decisions, the right to have children, and the right to parent children that we already have in safe and healthy environments, free of violence. The sweeping state of abortion ban policies are not only a reproductive injustice, it is also an infringement of our human rights. According to the Guttemacher Institute, the United States have enacted about 1,336 abortion restrictions across states since Roe v. Wade was decided in 1973. 44% of those restrictions were enacted in the last decade alone. On May 2nd, Politico published a leaked draft majority opinion of the SCOTUS case, Dobbs versus Jackson's Women's Health Organization. The opinion indicates the court's intention to overturn Roe v. Wade, stripping constitutional protections to abortion and placing abortion rights in the hands of individual states. While the official decision is still to come, and Roe v. Wade is still the law of the land for now, it is expected that the majority opinion in the leak will be reflected in the final version. The Guttemacher Institute, along with the Center for Reproductive Rights and other organizations, have mapped out what a post-Roe United States could look like state by state. Even states that do not ban abortion and/or expand access will likely need to respond to increased demands for abortion care, especially from those seeking care from neighboring states. The high demand for reproductive health care overall will have a domino effect on local perinatal and maternal providers, including the ones that are part of the Black Mamas Matter Alliance's network. This is why we at BMMA have decided to host this webinar. The abortion bans are just the tip of the iceberg, unfortunately. Some of the critical issues that will impact the maternal and reproductive health sector are the convoluted policy restrictions on self-managed abortion and criminalization of any pregnancy outcomes. How will this impact the perinatal and reproductive health workforce? What supports and protections are needed immediately for abortion care providers? Who will hold entities accountable for sexual health misinformation and harmful crisis clinic care? There are a lot to unpack. However, our goal is to start off with listening to the experts at the forefront of these issues. And so now, I am pleased to be joined by an esteemed panel of leaders. We have with us Dr. Joy Creer-Perry, who is a physician, policy expert, thought leader, and advocate for transformational justice. As a founder and president of the National Black Birth Equity Collaborative, she identifies and challenges racism as a root cause of health inequities. She is a highly sought after trainer, advocate, and speaker who has been featured in national and international publications. We have Dr. Monica Mclemore, who is a tenured professor and affiliated scientist with over 28 years of clinical nursing practice. To date, she has well over 70 peer-reviewed articles, op-eds, and commentaries, and her research has been cited in 3 amicus briefs to the Supreme Court of the United States and the National Academies of Science, Engineering, and Medicine reports. She is also a highly sought after researcher, speaker, mentor, and a fierce reproductive justice advocate and practitioner. As a highly coveted birth justice trainer and advocate, Jamara Amani is a licensed midwife, certified lactation consultant, and the executive director of the Southern Birth Justice Network, and co-founder and co-director of the National Black Midwives Alliance. Her dedication to making holistic midwifery and doula care more accessible has garnered her opportunities to speak before Congress, the United Nations, and several news outlets, all of which has led to increases in the numbers of Black midwives and Black doulas utilizing birth justice. We also have Dr. Jamila Taylor, who is the Director of Healthcare Reform and Senior Fellow at the Century Foundation, where she leads TCF's work to build on the Affordable Care Act and develop the next generation of health reform to achieve high quality, affordable, and universal coverage in America. A renowned health policy expert, Dr. Taylor also works on issues related to reproductive rights and justice, focusing on the structural barriers to access to healthcare, racial and gender disparities in health outcomes, and the intersections between healthcare and economic justice. And we also have Kwajalein Jackson, who is the first woman to lead the Feminist Women's Health Center. She serves as the executive director of the Feminist Women's Health Center in Atlanta, Georgia, which is a nearly 50-year-old clinic that is committed to providing judgment-free and accessible healthcare. She is a renowned advocate and leader in the reproductive health rights and justice movement and holds the esteem of being featured for her work on former US President Barack Obama's Instagram's page. Thank you to our panelists for joining us today. And as we transition everybody over, I want to thank you all once again for taking the time out of your busy schedules to talk with us today. And we will go ahead and get started. So in the wake of the leaked draft SCOTUS opinion, and this is for all panelists to answer, increased attacks on abortion access and reproductive justice and the worsening maternal health crisis in the US, many are trying to better understand and describe the relationship between maternal health and abortion care and reproductive health overall. This has led to a wide range of narratives surrounding this relationship. And in this vein, to start off our discussion, I'd like for each of you to discuss some of the narratives you've seen describing this relationship and what would you like to see change or amplified around this discussion around maternal health and reproductive health care, and of course, abortion care access. And we'll get started with Kwajalein, because I see you first.
Hello, everyone. Thank you, Angela. I think one of the narratives that I often am disappointed by is the idea that abortion is somehow a solution to maternal mortality, that rather than address the root causes of poor maternal outcomes and try to make it more possible for people to have healthy pregnancies and build the families that they want, the idea that, oh, if you're not healthy enough to have a baby, then you should just have an abortion. I think that while I am a ardent advocate for abortion care and think that it is completely necessary, I don't think that the two are connected in that way. We want to make sure that abortion is available and accessible, affordable, safe for anyone who needs it for whatever reason they need it. But we should simultaneously be working to make sure that the healthcare systems, the access to insurance, the social determinants of health, that all of those things are also in place so that people don't have to choose between protecting their well-being, their physical well-being, and growing their families. That both should be possible for everyone who wants them.
Absolutely, absolutely. Dr. Mclemore, did you want to jump in here?
I do. And first of all, thank you for having me. Good morning, good afternoon, good evening from wherever you're calling in from. The one that drives me up a tree is the one about how, and this was part of the Black Maternal Health brief that the National Birth Equity Collaborative did, led by Joya, who I know will be on with us later on today. This idea that the state's rights trumps a pregnant person's rights, like any state interest in any pregnancy, like that pregnant people are not the only arbiters of decisions around pregnancies, drives me up a tree. And for me, it's this notion that there's some hierarchy in who gets to decide, right? And whose interest is privileged over another interest. I get the ethical issue around wanting to make sure that, fetal rights and child rights and all this stuff, but the pregnant person is the only arbiter of that decision. And so when the state gets involved, then I think it becomes this huge distraction. And fundamentally, it comes down to this idea of the state's rights does not trump the human right of the pregnant person and their bodily autonomy to do what they need to do.
Absolutely. Thank you, Dr. Mclemore. Either Dr. Taylor or Jamara, did y'all want to jump in here?
Sure, I can jump in. Oh, do you want to go ahead, Dr. Taylor? Okay. Thank you. So one of the narratives that I hear often is that abortion is traumatic and kind of always a negative thing. I have supported people through abortions that have been really empowering for them, have made a huge difference in their ability to live their lives in the fullest way possible, and have also been a really healing experience. And so, I think that this notion that it's always a negative or bad thing, or no one wants an abortion, or, we should try to prevent all abortions. Sometimes it's really the best care option for people. And I think that we need to continue to uplift it as a part of full spectrum reproductive health that is not singled out as, stigmatized in a particular way. I think also this idea of bodily autonomy, as Dr. Mclemore mentioned, just, the idea that we control our lives and we control our bodies needs to be something that we're uplifting, particularly as Black women and Black people, that, that bodily autonomy, it's about reclaiming ourselves, because many of the wars around reproductive health have been fought on Black women's bodies. And so we have to always acknowledge that history, and that this decision around abortion restrictions actually really coincided with pushing midwives out of communities too. It began with the establishment of the American Medical Association in 1857. And I think a lot of people don't know that. So I think uplifting those history points is really important. And the last thing I'll say is that especially during Pride Month, making sure that we're uplifting queer and trans people that also need abortions, because this also tends to be a very white feminist centered kind of narrative that can be kind of trans exclusionary and centered on the experiences of white women. And I think particularly in this space, it's our opportunity to change that narrative and to center all Black people and how we're impacted by these decisions.
Great. And what my colleagues have said, I agree with all of their comments. And then just also want to acknowledge that, I work with these amazing women all the time, and I'm always just fangirling over them whenever we get a chance to share space and to share our knowledge with others. I think the only thing I'll add when it comes to this topic is the fact that I think that generally people continue to not make the connection between these horrific abortion-related restrictions in states versus the high rates of maternal mortality and infant mortality that they have as well. And so I think, we're in this moment that's so critical for reproductive justice as a whole, and the reproductive justice framework calls on us to talk about, all of the different pieces of reproductive health, whether it's, our ability to parent the children we have or give birth safely, as well as having access to safe abortion. And so for us, it's natural for us to be making the connections between maternal health and access to abortion, or the right to abortion. And so for me, I definitely want to see folks do more to make those connections. These states, are really a hotbed for a whole host of poor health outcomes generally. And then when we center the conversation around abortion and maternal health, we also see some similarities there in terms of those policies, lack of access, lack of insurance coverage, and, very poor maternal and infant health outcomes.
Thank you all for that. And thank you all for really uplifting and articulating from different vantage points some of these issues with trying to come up with some kind of one-stop shop narrative around this issue, to really understand that there's a lot of complexities and that we need to uplift all these experiences, and that it's more than just, it is more than just Roe v. Wade. And we know that in the larger reproductive justice movement. I'm actually going to shake things up a little bit, just a little bit, and in the order. So I want to circle back to Dr. Mclemore and ask you a key question here to just dig a little bit deeper. So your work has been instrumental in articulating and operationalizing reproductive justice in the scientific academy and clinical practice. And so can you describe what needs to be done immediately to support abortion and reproductive health care providers? And what can the academy and other health profession accrediting entities be doing on this issue?
Well, thank you for that, Angela, because it is always just so great to share space with all the brilliant systems call right now. So I created the list, but I probably could double this list now after having listened to everybody. So first of all, one thing that I also want to lay out there that's pretty controversial, but it needs to be said, is that Roe was not the best that we could ever get. And quite frankly, I think we need to start thinking about what could we replace it with. And, I am sort of over and done this whole, well, we can't get the Women's Health, Protection Act. No, okay, so then let's try something else, right? I think we are at this watershed moment where we have an opportunity to try and figure out, well, okay, Roe wasn't the best we could get. We needed those protections, yes, but what's better and what can we replace it with? So that's piece one. I have been going on and on about this, and I was saying, as we were preparing for this, I'm going to go hang out in Memphis, Tennessee with Choices. Shout out to Dr. Nakia Grayson and her entire team there. We're going to roll up with a whole bunch of Black midwives, because one of the things that we need to be doing is expansion of advanced clinician practice, right? Midwives, physician assistants, nurse practitioners. I've been screaming about this for 15 years around how we could expand our workforce as opposed to just flying physicians around all over the country. We could really train advanced practice clinicians and really allow them to do abortion services across the spectrum. And Dr. Michelle Drew, shout out to her, did the first ever all-day pre-session abortion-related workshop at the American College of Nurse Midwives in Chicago. And I was really excited to be able to go and to be able to do that. Hands-on training from professional organizations, not just in abortion care though, because we also need to work with our emergency department nurses and other people. We need ethics training to get people to understand it's not our job to call the police on our patients, right? That's not in the American Nurses Association Code of Ethics and Code of Conduct. That's not our job. We are not extensions of the state. We need boards of nursing and medicine to fast track licensures and accreditation of different facilities, right? So Choices wants to open clinic in Illinois that's 3 hours, that's equidistant from, Amtrak and other sites. Well, we still got to get licenses in those states. We need state boards of nursing and medicine, not to be, barriers or obstacles at this point. We also need, everybody should fund the National Network of Abortion Funds and make sure that practical support is normalized and part of what, folks need. I think we also need to have workforce support. So in those trigger states, and I feel very strongly about this. I think the first time I heard this was from Reproductive Jobs and Renee Bracey Sherman, but we can't have abortion clinic workers on the unemployment line, right? Somebody should step forward and guarantee those people either relocation, cancel student loan debt, guaranteed employment within our movement. That somebody, that needs to be a thing, right? And from where I sit, that we can't lose that brain trust. And if we allow that to happen, then I am very fundamentally worried about, the state of our seriousness in wanting to be able to support people who not only work in abortion care, but we know that workforce is mostly, Black and brown folks and folks who really have committed their lives and to this movement, whether you're a radiology tech or ultrasound person, counselor, medical assistant, nurse, physician. We can't just worry about the physician workforce. The rest of the workforce also needs to be valued and cared for their devotion to the field and to be providing abortion access when real falls.
I mean, brilliance, right? Thank you, Dr. Mclemore, for that. And before I even move on to another question, I didn't know if any one of our other panelists maybe wanted to also add any addition to what Dr. Mclemore just shared.
It's hard to add on to what Dr. Mclemore said. Sorry, we're always speaking at the same time. It's hard to add on to what you said because it was so complete. I do want to just uplift and shout out the abortion doulas and full spectrum doulas in the space as well, because they play an important role and we don't have enough of them. So that's one of the things that we're doing is trying to train more abortion doulas to be available in those situations where people need support, whether it be at a self-managed abortion or at a clinic. So I just wanted to add that to the workforce list, but beautifully said.
Yes, Monica, Dr. Mclemore is hard to follow because that mic just, always drops. One thing that I will add to this too is, I know the conversation is very much focused, for this question in a provider space and on the clinical side of things, but also the issues around insurance coverage of abortion, right? Like, we're here to talk about rights and access, which is key to, the conversations around the Supreme Court, but there are also millions of women that can't even use their insurance coverage for an abortion that they need. And so that is why abortion funds, Dr. Mclemore mentioned the National Network of Abortion Funds, which, is a network of funds that are operating in states all across the country. Some of them are operating in other countries to make sure that women have the funding that they need, or birthing people have the funding they need to get an abortion. And these are mostly people that don't have that insurance coverage. There are efforts to ensure that, there are a couple of bills, that are moving through or that have been introduced in Congress. The EACH Act is one of them that would ensure that women and birthing people on the Medicaid program, as well as some private sources of insurance that don't cover, abortion can get the coverage that they need. So also wanted to bring that into the conversation because the rights and access piece is part of this, but then also we're leaving so many people out of the conversation and out of access because they don't have that coverage. And so have to work really hard to get funding out of pocket to be able to pay for the abortion that they need.
Thank you so very much for that, Dr. Taylor, and rounding out that the points that Dr. Mclemore made, and including Jamira. I am so excited that we have joining us Dr. Joya Creer-Perry, and I'm gonna mess with you, Dr. Joya. You just missed Dr. Mclemore mic drop.
I'm sure, but you know what? I'll watch the video.
Yes. So, Dr. Joya, I'm actually about to ask our next question for you, because we really do want to hear from you and hear about the wonderful work that's happening at MBEC, and know that we have, and because you all are doing great work, we have little time with you today. So in January of this year, we know that The National Birth Equity Collaborative, NBEC, led an open letter that was sent to the New York Times that reaffirmed Black women policy leaders' efforts in calling for reproductive freedom. It served as a call to action and a direct response to the seminal brochure, We Remember, African American Women for Reproductive Freedom from 1989. And so can you speak to the historical legacy and lasting impact of narrative change work in the reproductive justice movement and how we can honor and continue this legacy today? And also, please feel free to talk about the great work you all are doing at NBEC around this issue.
Thank you so much, Angela. You know, I always love seeing your smiling face. I feel so good. I feel at home seeing everybody today. Yay. So yes, back in January, you know what, we were really, back in September, honestly, Donna Brazile emailed several people, and one of those people she emailed was me. And she said, hey, I went in my basement and I found this brochure. It was signed by Rosa Parks and it was titled African American Women for Reproductive Freedom. And at the time, there was a Black woman who was the CEO of Planned Parenthood, Faye, similar to there's being a Black woman, the CEO of Planned Parenthood today. At the time, Faye was calling out white racist folks in the reproductive rights movement for not wanting to stand behind the need for have access for people of color, to focus on Medicaid, to focus on advocacy in the states, to even look at making this not a wedge issue where you have Black families separated around this idea of choose me, pick me. This is not a new conversation. They were talking about this. Black women have been talking about this a long time. And so when Donna called, she said, you know, I'm mad. It's been 30 years. We made this brochure. We stood on the steps of the Supreme Court, and Doc, here we are today. Same conversation. In fact, it's worse. You know, between patriarchy, religious fundamentalism, and white supremacy, they have doubled down. All the other countries are getting more liberal and more open in their conversations around access to bodily autonomy. Some countries that we blame and shame in the past are expanding their access to abortion and contraception. And here we are in the land of the free, passing rules where we can sue people and stalk people and having sanctuary cities for the unborn, where like it's a slave catching. We're going backwards, right? We are still litigating the Civil War. We have not decided that human beings are fully human at birth in this country. We still litigate the choice between states' rights versus human rights. And so that is the beginning of the conversation. So I was like, oh my God, this is mind blowing. If I could do anything with Donna Brazile, that's my homie, you know, she's from not too far from where I'm from, and honoring this legacy. So we spent from September to January working with organizations to reframe and to think about how would we think about this going forward? What is it that because back in 1989, I was a senior in high school. And I thought we were doing free Nelson Mandela, but that's about as much advocacy as I was doing back then. But no, here we are today, and the situation has gotten much worse. We had Donald Trump as the president. We had a stolen election. We had January 6th. We have so much happening. How do we calm the noise and not make this continue to be a fight of choosing and picking? And that we had to really turn that down. So we worked with advocates to create a document that honored our history, that honored the fact that Black people have always fought for personal bodily autonomy. When we were enslaved and brought here, we didn't say, oh, that's cool, we're gonna hang out. We were fighting everybody. It wasn't just one person fighting to be free, we're all fighting to be free, and we still are doing that. And honoring that is not just a woman's issue, all genders, all sexes, all religions, all. So we have on ours, we have people like the Urban League signed on, folks across the entire Congressional Black Caucus, including Clyburn, signed on to a document that says abortion is an issue for Black families, right? So saying the word out loud is not gonna kill y'all. Abortion, abortion, abortion. You can say it till your teeth gets white. And so it's important that we honor that the full range of reproductive autonomy. As an organization that focused so long on Black infant and maternal health, trust me, some of the people who historically loved NBEC don't love us no more. We lost some friends, but that's okay. They weren't real friends. If they don't recognize that mamas are deserving of the full range of reproductive options, and that babies also are supported when mamas have the ability to control their own bodies. That if a mama does not have the ability to make decisions for herself with her provider, and as an OBGYN, I'll just end with this story that people don't understand what abortion means. Not people don't understand. folks have politicized what abortion means. It's become a wedge issue that just separates families, separates communities. And the truth is, as an OBGYN, when patients come to me, and if you're 10 weeks pregnant and you have breast cancer, I say to you, listen, if you decide to maintain this pregnancy, you increase your risk of death to yourself. So that person, that human being who's fully formed that person could be homeless, or it could be someone who lives on Central Park, then has a decision to make for themselves, because I don't have the cancer. It is not my decision, and they might talk to their spouse or partner about it. They might talk to their pastor about it, or they might just go home and think unto themselves, but they are the individual living soul who has to decide what they want to do. Many times in Black families, they come back and say, I want to maintain this pregnancy, because that's part of a ethic, that's a part of our culture. And that is not, so although that's something I probably would not choose, I'd be like, listen, sis, honey, I'm about done, right? But that's my decision for me. I don't put that on other people. What the states of Mississippi and Texas are saying is you don't even get to make that decision for yourself. That you are going to have to, I have friends who are practicing medicine in Texas today who've had to sign non-disclosure forms because their hospitals are telling them, if you get sued by having that conversation, I'm not going to cover you. What do you think that's doing to healthcare right now today? So although we talk about the fall of Roe, 1,400 bills since Roe was passed 50 years ago, 49 years ago, have been passed to harm Roe. Roe fell the minute it was passed, baby. We will never see a day that people see people who are marginalized as fully viable at birth. So what I'm hopeful for, what I'm optimistic about, and what MBEC is working on is the daughters and sons of the Reconstruction, reframing this conversation and saying, listen, this has always been a litigation of states' rights versus human rights. This has never just been about an abortion access. And this is about the First Amendment and the 14th Amendment. This is about, we believe that this nation should be one that includes everyone, that the least of these are the most important. The least of these have the answers. There's no trickle down policy. There's no trickle down economics, and that we really need to center the folks who are in community. And truthfully, every other high income nation, they don't even have a law around abortion. Why are we even in people's business? I'm optimistic that this whole leaking of the law goes back to say, what is the point? Why are we even here? Are we going to start? I want to start tracking sperm. I think sperm is viable. So I think every human being who's born should have a DNA test so that we assure that the proper father, come to people who do child support work, the proper father is paying his child support. It's coming out of his check. White men, Black men, everybody, patriarchy. I'm coming for your sperm. You pass this bill, guess what? We're going to just start coming for your sperm. That's next. That's what I got.
I know that's right.
I'm serious though. I am serious as a heart attack. I promise you.
Oh yeah. I know that.
I'm coming for some sperm. I'm just letting you know. And I want some abortion stories from some men, because I know y'all, you paid for some abortions and you got really good jobs for it now. Okay. So I'm gonna need to see some abortion stories from some men.
Absolutely. Dr. Joy, I appreciate that so much, and for being unapologetic, because today that's what we're talking about, changing the narrative, making space for these conversations and for these uncomfortable things that people need to hear around these issues. And so say that, yes, thank you. You're getting a lot of high fives and accolades, Dr. Joy, in the chat. And so I'm going to move to our next panelist, Kwajalein, and direct this question for you. So as the executive director of the Feminist Women's Health Center, you've seen firsthand the ways that narratives affect abortion clinics and providers every day. How do narratives surrounding Black maternal health and abortion care impact the way you work with patients and communities on the ground? And also feel free to provide any additional commentary as well. Thank you.
Thank you. So I'll start by saying, we are an independent abortion provider, meaning that we are not a franchise, we're not connected to a federation. We are a nonprofit clinic that was founded in 1976 that's been providing abortion care since very shortly after the Roe decision. We're in Atlanta, Georgia, and that means that the majority of the patients we see are Black. It also means that the majority of the people who are providing care in my clinic are Black. And so one of the things that has been tremendously difficult, and is true of clinics all around the country, is the way in which the violent white supremacist extremists gather outside of our spaces, harass and harangue both our employees and our patients, use specifically racialized language to attack and berate people, co-opt the language of the movement for Black Lives, talk often about Black genocide, use those things to try to shame and demean us. And that has only exacerbated over time. And so I think that that's one thing that is really critical. I find that even though there is a sentiment that this is about God and this is about babies, so often it comes back to Black people and Black people's inability to make decisions on our own behalf, our somehow ineptitude in understanding what our choices mean and standing firm in our decisions and needing some sort of intervention to step in and show us the way, to paternalize and patronize us in our decision making. And so I think that that is one thing that is abundantly clear in what I see on the ground. The other thing that I think both Dr. Taylor and Dr. Mclemore brought up is this way in which the state so often puts so much attention, energy, resources towards this unending fight against abortion, while the other health outcomes that they claim to care so deeply for go neglected generation after generation. So one resource that I'll point folks to is the Evaluating Priorities study. And I think one of the researchers, Terry Ann, is on the webinar today, Terry Ann Thompson. But it essentially looked at the states where the most number of abortion restrictions and the most extreme abortion restrictions existed, and also looked at supportive policies for maternal health, for infant and child health, for school programs, the things that they espouse, the things that they say that the state is standing for: families, children, women, and just looking at the number of hypocrisies that exist in those tables, the ways that they continue to disinvest in the family, and particularly in the Black family, while at the same time saying that family is the reason that they want to push forward these abortion restrictions. So I think that that is something that continues to infuriate. It should infuriate all of us. Because again, abortion is not a choice. If the only reason that you are choosing abortion is because you have no other means to take care of your family, then it's not a choice. It is a reality. It's not a choice if you don't have the option of birthing children that can walk safely down the street or attend school. That's no longer a choice. So at the same time as we want to continue to protect abortion access for whoever needs it, we also need to be working on the ways that white supremacy continues to prevent us from living full lives, that continues to prevent us from being whole and well in the world. Those are the things that feel really critical to me. The last thing I'll say is just that I want to remind folks that independent abortion providers are providing the majority of abortion care in this country, providing the majority of abortions later in pregnancy. And I'm not the only person who is running, a Black person who is running an abortion clinic. And so understanding that there are Black-led and Black-owned abortion clinics around this country that we should be supporting, it is devastating to watch clinics close, to watch clinics shutter. For that to be what we're on the precipice of. And so being able to invest in and support the independent clinics that are not only providing abortion care, that in many cases are also providing comprehensive reproductive health services. We're trying right now to double down on our contraceptive services, to revisit fertility and insemination that we used to do to try to think about how we can better support birth and pregnancy, we want to make sure that we are not just focused singularly on abortion, because that's not the only thing our communities need. And so we want to make sure that our clinical spaces are also using that reproductive justice frame in order to provide quality care that is aligned with our lived experiences.
Absolutely, absolutely. Thank you so much for that, Kwajalein. I'm going to now immediately move to Dr. Taylor. So Dr. Taylor, as a maternal health policy expert, you are highly attuned to the ways narratives shape public policies impacting Black women and birthing people. What harmful narratives about the intersection of Black maternal health and abortion care are policymakers clinging to, and what helpful narratives are they embracing? How can narrative change really generate meaningful policy responses?
Well, first off, I did want to follow up on Kwajalein, her beautiful remarks there, and just wanted to offer another example of the hypocrisy, the infant formula shortage. So just wanted to flag for folks, since we're talking about the hypocrisy, that there was a bill that came to the floor, I think it was a couple of weeks ago now, and only a handful of Republicans, I think, supported that, but overwhelmingly they did not support solutions to help address, issues around the infant formula shortage. So again, just another example, but again, I think we could probably spend this whole webinar counting down the different examples of how they continue to not support families and children, particularly those that from our community. So just wanted to put that out there. I think for this one, the thing that I want to lift up is saying the word abortion. Joya already put this out there, but it's like, even among the policymakers that are supportive of our issues, they refuse to say the word abortion. And our sister, Renee Bracey-Sherman, has already been lifted up in this conversation, but she has been working so hard to get policymakers, including, the president, to be more out there and clear using the word abortion. It's so critical in terms of just the broader work we're all doing to destigmatize abortion. And so wanted to put that out there. But I also feel like that's something that we've been working on for decades now, just getting them to say the words. And, if it's so important, because that's where the conversations around the intersections come in. When we think about the RJ framework, in a policy context, harmful narratives, I think generally we have seen some promising support for maternal health, especially on the federal level, but we're still sort of having some challenges in terms of educating, policymakers on the intersections. And so I think that's going to be important in the narrative work that we're going to be doing moving forward. And I'm not just talking about intersections between maternal health and abortion, but also, economic justice, the environment. We're all sort of working on all of these things, and that's what our community requires, right? That we work on, gun violence. Our community requires us to work on all of these things together, because that's our lives. We're all grappling with all of these things. And so I think that is going to be key. I think even if you look at some of the debates around the Build Back Better Act and, whether or not we expand the child tax credit, whether or not we implement certain protections for students, all of these things are reproductive justice issues. And I think if we had policymakers do more to see that when it comes to policy, and look, I know it can be hard, especially when you're on a certain committee or you're dealing with certain funding streams, that you tend to sort of be very siloed in your approach to the issues. But that just doesn't work, particularly for communities that tend to be marginalized historically. So I think I will put that out there. And some of the work is happening, right? In addition to all of the wonderful women and groups that are representing on this webinar, folks are starting to be more intentional about encouraging policymakers to make those connections. Folks really, the infant formula shortage, organizations really came out and talked about the connections to the maternal health crisis, even conversations around abortion. Again, economic justice, we're making sure that we're centering that, in our conversations as well. And so I think if we can continue to educate policymakers on those intersections, why they make sense, why they're important, particularly for the Black community, then I think we can use that to help drive and hopefully influence them in terms of, developing policy solutions that are more comprehensive, that support our needs. And then the last thing I'll say too is that, most of the folks probably listening in here know about the Black Maternal Health Omnibus, a legislative package that all of us have worked on over the last several years now. We're starting to think about Omnibus 2.0, which is going to be more expansive, thinking about issues around fertility, fibroids, really just starting to think broadly about the work. And maybe we should be having a conversation in the context of that about abortion. Is there something that we can be thinking about, as we think about the environment in this moment, in this next iteration of the Omnibus, what can we be putting in place as a part of this new package that will just help to soften the field a little bit on abortion? And so yeah, I'll leave it at that.
Thank you so much, Dr. Taylor. And I'm going to round out my pre-developed questioning with the wonderful midwife, Jamira Amani. And then from there, ask you all at least 2 more questions that are generated from the audience. And once we get those general questions from the audience, is open up to all panelists. Jamara, I love you. I love you so much. And I love the work y'all are doing, especially with the National Black Midwives Alliance. So yes, you are a leader in Black midwifery and birth justice, and created the Birth Justice Bill of Rights. And you implement these principles through training and educating doulas and midwives. Can you describe how the intersection of Black maternal health and abortion care manifests in these trainings and developing the Black maternal and reproductive health care workforce? And what are these opportunities for narrative change that shows up in that work? I know you started to speak on this a little bit earlier on in the conversation.
Well, I love you too, Miss Angela. So thank you for that. And yeah, that's a huge question. That's definitely something that we're focused on. I represent National Black Midwives Alliance and Southern Birth Justice Network. And in both spaces, we are working to develop Black midwife and doula workforces. And we do that through trainings, educational series, and certifications. And one of the things in both of those spaces, looking at doulas specifically, really trying to build up that abortion doula workforce. Most people don't even know what abortion doula is. And once they find out, they're like, ooh, I want to know more. And it's a really important conversation, because I think many times abortion, people experience it in very isolated ways. And I will just say that one of the most beautiful experiences that I've had with abortion was very community-centered, deeply spiritual for the person who was having an at-home abortion, and was doula supported. It was supported with ceremony and herbs and, kind of this lens around restoration and like, how do we, heal your body after this experience in a similar way that we might support a postpartum mama. And that's a really, really key important thing. And so one of the things that we do is frame this as the abortion to home birth spectrum, because I like to talk about how in many places abortion is not accessible, but in a lot of those same places, home birth is not accessible, right? And so it's really an assault on all of our reproductive and sexual health rights. And so we have to address it from that framework, that umbrella. Otherwise, we get pigeonholed into these single issue kind of situations, and we have to really broaden the conversation to make space for everyone. So that's what we talk about in our abortion doula trainings, is how to really support someone through that. And trying to get more abortion doulas to be supported through payer systems, through insurances, and more abortion funds to also open up that space to provide for abortion doulas, because people need support at clinics. They also need support at home. They need support getting to a clinic. So a lot of that pre-work is important, connecting people with resources, and then that follow-up care, making sure that they are okay and can make a full recovery after their experience. And I think that one of the things around changing the narrative that we've been able to do, because a lot of people enter doula work being really centered around, focus on pregnancies and babies and wanting to see healthy births. And that is absolutely what we're doing. And also making space for more conversation. And I think one of the barriers to that is this kind of religiosity that has been attributed to abortion. And so we address that by really talking about the science of what's really happening in the human body, and that we don't talk about babies until the person who is pregnant is ready to acknowledge what is inside them as a baby, because it's their body and it's their story to tell. So we talk about it in scientific ways and don't assign our own values to that. That's a really important part of the training. And I think that this whole religious conversation is not our conversation. It's something that is a very colonial conversation, and part of decolonizing reproductive health is reclaiming the conversation and looking at it from a spiritual lens that actually honors who we are and honors the totality of what it means to be in a divine human body that has, full reproductive capacity and autonomy. And then also to address the workforce question, looking specifically at midwifery. We know that less than 7% of midwives in the United States are Black, and less than 2% of birth centers are Black owned. So we need more providers that can address the full spectrum of reproductive health. We need laws that support access to home birth. We need to expand the definition of a midwife and the scope of practice of midwives in most states in this country, as Dr. Mclemore said earlier, to include supporting abortions, but also to include, many different reproductive health needs. And those trainings are really important, that we honor the needs of our communities, and also to, as I mentioned earlier, to just acknowledge the history that midwives have traditionally provided support for abortions. And that's honestly a big part of the reason why the profession was targeted, because it was seen as, kind of witchy, like a very powerful kind of way to make sure that, primarily women were having the control of their bodies and of their reproductive health. And the white male power structure, primarily led by the American Medical Association, really didn't like that. And so now what we're seeing is criminalization of pregnancies, right? Because how dare you have power over your own body, right? And so when we exercise that power, we tend to be criminalized. And that is whether someone chooses a home birth, right? Or whether someone chooses an abortion. We're seeing an increase in these criminalizations around providers of those types of services, and of the person who is going through that experience, right? The client or the patient. And so we have to ask the question, who benefits from this criminalization? Who benefits? And I'm located in the state of Florida, and I'm part of a coalition where, shout out to Floridians for Reproductive Freedom, where we are highlighting the Abortion Injustice campaign, which actually looks at what companies are contributing to the campaigns of legislators that are making decisions to outlaw abortion. And there are companies like Florida Power and Light. What does the electric company have to do with abortion? Florida Blue Cross Blue Shield. Why would they be contributing to the campaigns of legislators who are passing 15-week abortion bans in Florida? And that abortion ban goes into effect July 1st. Thankfully, Planned Parenthood has filed a lawsuit along with other organizations. We'll see what happens with that. But who benefits from this criminalization is the question that we always need to be asking, and tying it back to economic justice, and really trying to push the narrative to be centered more around birth justice, right? Which is inherently rooted in things like abolition and telling our stories. So this is all connected. So building our workforce of people who are centering their care in birth justice actually helps to shift that narrative and deliver more quality, holistic and humanistic care to people. And I'll just say one more thing. One of the ways that we're doing that in South Florida is through our Miami Birth Justice Initiative, where we are working with local hospitals through the Jackson Health System, which is the third largest health system in the country. And the idea is that if we can transform Jackson, we can transform any hospital system. And we're working with Jackson, not against them, working with them to train their medical residents around birth justice, to bring birth justice doulas into the hospital, and to create policy shifts that are centered around the Birth Justice Bill of Rights. And I'm telling you, it can be done anywhere. I'm complete. Thank you.
Thank you, Jamara. I'm yes, I love you so much. Thank you for the wonderful, divine, and necessary work that you all are doing at the National Black Midwives Alliance and at the Southern Birth Justice Network, especially for the wonderful healing and life-saving work that you all are doing in Florida. And speaking of exactly what you just talked about around criminalization, one of our audience questions is centered around that. And so I'm going to ask this in general for all panelists, so feel free to jump in here. So an audience attendee posted a question, and it reads, they're saying, thank you so much for your time, and they really appreciate all of the knowledge that's being shared here. And it says, you are all a blessing to us. Can any of you speak more on the criminalization of pregnancy outcomes and what steps you would like to see to combat that? So again, speaking on this topic of criminalization of pregnancy outcomes.
Because this is tied to what Jamara just said and criminalization. So I was honored to go to with the mothers in Montgomery, where we're honoring Lucy, Betsy, and Anarcha. And Anarcha was a healer, and J. Marion Sims lied and said that he fixed fistulas, and he did not, and he hid her. And the American Medical Association helped him to hide her, and he used her as a nurse in the clinics. So when you go to the site, you will see in Montgomery that he extracted from her wisdom, lied about it, and then used her body to heal other people, and then continued to lie. And the American Medical Association was complicit in this lie. And this continues. After him, the office was held by another Confederate person who was Crawford Long, who, if you're from Atlanta, you know that name. He supposedly founded anesthesia. We had anesthesia in the continent of Africa for thousands of years. We've been using opium around the world, communities of color. And so the criminalization is an attempt to hide the shame of the blame of white supremacy when it's stealing and extracting and not actually investing in life and birth. And so the reason people don't say the words abortion is because they know when you speak words, they become real. And so the white supremacy won't even speak the words. So that's why I say it to you, that you are both showing us that your spirit is bad, and you're also showing us in a material sense that you're willing to pay people harmed, hidden. Poor Anarcha was found at a hospital in New York. The only reason we know that she was still not healed is because he hid her, made her work, and then a reporter found her in a hospital in New York working as a nurse and also still having a fistula. So we cannot continue that legacy. Still today in 2022, we must be honest and have truth and accountability for the history and legacy of the shame of white supremacy in this country. And that's it.
And you know, I could go on this all day. So, and Jamar, it's always good to just like share space with you, because one thing I want to add to what you said, it wasn't just the white physicians in the American Medical Association. You got to remember the white nurses teamed up with them to be able to discredit the grand midwives. Why does that matter? Well, because the greatest number of criminalizations that have happened have been because white women have been using child protective services and other punitive issues to be able to make judgments about the people that we serve. One of the reasons I didn't say in my notes, even though I had it there with a big question mark, was whether or not we should be thinking about expanding nurse-family partnership and other home visiting programs around self-managed abortion. But then I thought about it and I said, no, because they have training needs first to not criminalize people in their homes, because the truth of the matter is we have criminalized poverty, right? I mean, the carceral system is, basically punishment for poverty. And so as we, and the association between, Black people and people of color and poverty, as Kamara Jones always says, is explained by structural racism, right? So the criminalization of pregnant people has to do with this real problem where a lot of people have fundamentally been trained to think that white people are default humans that can serve as a standard for the rest of the population. And that if we don't assimilate into whatever their function of how we should exist is, then somehow we need to be controlled and or contained. So the criminalization of pregnant people is really about, this intersection of structural racism, which keeps, Black and other communities of color poor, and therefore people use poverty as a proxy when really it's not. And, the fact that pregnant people don't do what we want them to do is like antithetical to the ways in which healthcare providers are trained, right? I'll give you a perfect example of this. Why are we like measuring entry into prenatal care as a quality metric? Especially for people who have had babies before. Like why?
Because we're racist? I don't know.
Right? I mean, I'm just saying like this whole demography and how we collect data. I mean, that's the other thing I didn't say in my recommendations when we started too. We're going to have to rethink how we collect data as part of roll falling and not having abortion. I mean, our abortion statistics have always been horrible because they've always been underestimates, right? But like we need to rethink how we want to be able to collect data that's not eugenicist. So there's that, right? Demographics and all these population-based studies all is grounded in some notion that there should be distributions of humans on the planet in different socially defined racial categories, which is ridiculous. So Angela, can I answer 2 questions though that was in the chat that people have not put in the Q&A? That drives me up a tree because anyway. The first one is this: can the Turner Way study assist us? And I'm an answer person, no Diana Green Foster. That was very important work, but that work was to inform legal arguments, not necessarily to inform how we want to be able to think about the role of abortion in civilized society, right? So it still has this notion that, people who did not receive the wanted abortion that they wanted were poorer. Like the outcomes on that are still weird, right? Because it's still in a white supremacist framework or white feminist framework that's not really helpful. So it might be helpful on the legal side, but it doesn't, I don't necessarily know, there are pieces of it that are incongruent with reproductive justice. And I think we can be making better arguments. So there's that. The other question is this idea about training. Who gets to do abortions? I need people, like, if you have not had educational exposure to abortion exceptionalism is what is in your purview. There is nothing special. First of all, abortion is like 3 different things. It can be an induction, it can be medication, it can be aspiration. So this question about whether or not nurse practitioners or other advanced practice clinicians have the appropriate skill set to be able to do an aspiration, they can participate in abortion care without ever doing an aspiration. They can provide fact-based information, counsel people, and get informed consent from somebody, right? Doing an actual procedure is not just abortion care. So I'm gonna need us to reframe this whole discussion about what does it even mean to participate in abortion? If you're never gonna touch a patient and never do a procedure, if you are committed in making sure they have fact-based information and making a referral, then in my view, you've done your ethical job to get the people the care that they need. To this point around aspiration abortion, there are 6 states where nurse practitioners have been, and then there was a whole ass study that looked at people over time that showed the efficacy and safety, a non-inferiority trial. There's been, 7 papers in the American Journal of Public Health showing the safety and efficacy of advanced practice clinicians providing abortion care. And I want us to really get beyond abortion exceptionally and people who do IUDs, people who do all sorts of other, uterine endometrial biopsy, people who do all sorts of other, uterus-based procedures are able to translate their skill set, because the skill in and of itself, it's not that difficult. I also want us to start to acknowledge the fact that patients themselves can be their own abortion providers and normalize that. Right. So this special patriarchal thing we got going on about who did the abortion and who didn't and how we count those and all that other stuff. The patients themselves can be abortion providers if they're willing to take their own pills. So I get very emotional about this. I'm gonna seize some time back to everybody else. I had to answer some questions because that drives me up a tree.
Dr. Mclemore. Others that want to provide any commentary on the question around criminalization on pregnancy outcomes.
The only other thing that I was going to say, Dr. Mclemore already touched on, is just this idea of healthcare workers being agents of the state, and the fact that people are often so fearful of going in for emergency care because of the possibility that they will be criminalized. So they would rather bleed out and hemorrhage at home than go into an emergency situation where they might have to go to jail, or might be at risk of being deported, or might be at risk of having their other children taken from them. And so us really trying to reframe and retrain people to prioritize the well-being of the person who is in front of them, to make sure that they have the highest quality care, rather than, again, infantilizing them and deciding that they are no longer responsible enough or informed enough or educated enough to take care of themselves after they leave your care, that part. And so I would just, there are certainly legal organizations that do a lot of work to try to work on behalf of pregnant people. And, you know, I can only imagine that after the final Supreme Court decision, that this is going to be an even more precarious situation where people will be afraid to cross state lines because they think that state troopers are going to be on their tail. And the continued like invasive procedures that will be recommended by politicians in order to try to legislate people's decisions about their bodies. So, I mean, I don't have an answer except for that the work that folks like Dr. Mclemore are doing, and others who are working within academic institutions to try to, and what Jamira shared as well, to try to really course correct for the ways that the medical industrial complex has been so harmful perpetually, is one hope that we have.
Yeah, and Angela, a nugget that I wanted to add to, I mean, this is sort of, you know, sort of clear within, I think what we're all saying here is that, you know, this is going to have a disproportionate impact on Black and Brown people. I just want to be clear about that. I think, you know, we have to unpack the fact that everything that we're talking about here, like we're talking about Black and Brown folks. White women are not going to have, you know, the same challenges that we are going to have when it comes to issues around, you know, how likely we are to be criminalized if we are, you know, accessing abortion, going across state lines, you know, our family members helping us secure, you know, those abortions. And so I think it's important to put that out there. You know, we are talking about, you know, state violence like across the board here. Like this is, you know, I hear so many people talk about, oh, women are going to die. This is a matter of life and death. But for us, it's on a different level. And so just wanted to, you know, put that out there, especially because I know, you know, folks are starting to talk more about this criminalization piece without lifting up the racist dynamics that are also need to be a part of that conversation.
So I just want to uplift and just speak in solidarity with healthcare workers, because I think that from my experience, most healthcare workers want this information, are looking for models and frameworks for how to better take care of people. And that oftentimes it's the policies which are dictated by dollars, this profit over people motive of the medical industrial complex that keeps human beings that are healthcare workers from being able to extend, you know, holistic and compassionate care to others. And so I think, again, for me, I'm sorry if you can hear my children, my homeschooling children, they're getting loud. So for me, it's about training, and it's about getting into the medical schools and getting into the midwifery schools and getting into the residencies and the hospitals at the training level, and having, you know, conversations around how do we shift the policies to center people rather than, you know, profit or, you know, these other motives. And I think that there are a lot of us in these spaces, right? So I think we're kind of well sprinkled and infiltrated to be able to make that impact. Whereas, and this is not to downplay at all, like the legislative policy work, super important. But I think that there's enough of us that are like very progressive minded and kind of already reproductive justice and birth justice centered that can bring our power and our voices into these spaces that we're already in and just be louder, you know. And I know that that always assumes, you always assume some personal risk when you do that, whether you're a nurse on a labor and delivery floor, or you're in, you know, an abortion clinic that's, you know, reporting Black people or what have you. But I just want to just encourage all of us to just like kind of dig deep and think about the places where we can invite some of the speakers on this panel to, you know, offer some trainings, or, you know, local birth justice organizations that, or reproductive justice organizations that may be in your city, and to bring that to local decision makers, because a lot of these changes that are possible can happen on a local level. And I just want to uplift the, you know, the local healthcare workers and the ability of cities to even override states in terms of their motives to criminalize people.
Absolutely, absolutely. Thank you for that, Jamar. Oh, Dr. Joy, go ahead.
I just, because I love that, Jamar. And, you know, we've been doing that work, and like you, always optimistic. And where we sometimes get stuck is people have the policy, but they don't want to change their belief in a hierarchy of human value. And so this, having this, all of us say that we have the collective. So you as one individual on this unit, so maybe there's one nurse who's like always mean to the patients. We can collectively hold that person accountable, that we're changing the culture to one that says everybody's valuable, right? And so we are at a critical moment that we can change the belief inside of healthcare systems to one where we value every patient fully and see them fully and don't minimize them and harm them and police them, which is how we were created as a healthcare system to do.
Exactly. And I wanted to just quickly uplift that in sharing that in terms of talking about how these trainings can be impactful in healthcare settings. Just also want to lift up that because home visiting was mentioned, also social services, our education systems, any kind of system that engages and interacts with Black women, Black babies, Black families in our local areas and our communities. And then also want to uplift Azza Nahari with Mama Toto Village. We love you, sis, and congratulations on opening up a beautiful, beautiful center in Washington, D.C. I'm just sharing to you, Jamar, that Azza said, do not apologize for those babies in the back, because that is reproductive justice. And if our audience didn't get nothing else from this wonderful and dynamic conversation today, what you heard over and over again is that reproductive justice is comprehensive. It is the answer, it's the solution, along with birth justice. Black women have come up with the solutions, y'all. Y'all got to listen to us and actually follow through in what we are promoting. That is all the time that we have today, you all. Before we show our last slide for today, I did want to give an opportunity to any one of our panelists who want to uplift any program initiative that you're working on, just to bring some awareness to other initiatives that are happening that are led by Black women. I do also want to lift up Sister Song and Black Feminist Future, who are also putting together a major effort this Saturday and Sunday for Juneteenth. Black Bodies and Black Lives. I might have messed up that title, but please check out Sister Song, check out Black Feminist Future. Y'all join them in Washington, D.C. They are rallying around our lives and for our freedom during this Juneteenth weekend. And I want to open it up to the panelists to raise up your initiatives as well.
I'm not necessarily sure if she's going to shout out her own work, but I definitely want to shout out the talking points from the Black Maternal Health Federal Policy Collective. It is a 4-page document that I think is very comprehensive that talks about the relationship between abortion access and Black maternal health. And I reference it often, and I'm hoping somebody will put the link in the chat.
Thank you, Dr. Mclemore, for mentioning that. And that is a good introduction, because I was going to offer too that the Black Maternal Health Federal Policy Collective is a group that I brought together of Black women leaders, really helping to develop policy solutions around maternal health, but also, we're also thinking about abortion too. And one of the first resources that was put out there in terms of the messaging around the intersection of abortion and maternal health came from our group. And so we will make sure that is put into the chat, or even in the follow-up materials that's going to go out to folks who participated today, to make sure that you get that. And then I just also want to say too that there are some outstanding Black leaders, Black policy leaders in the US Congress, as well as in local and state offices that are want us to be helpful and to tell them, what to do in these moments. And so just wanted to lift that up for those of you that are listening in and trying to think through how you can be more involved, or, how you can influence policy at any level of government. Reach out, find out who your representatives are, and definitely reach out to them, tell them how important these issues are to you, and offer solutions. They're waiting in the wings and they want to be helpful. So I wanted to lift that up as well.
I'll just briefly talk about our initiative. It's called the Daughters and Sons of the Reconstruction. We know that there's a lot of money that the Daughters of the Confederacy have used since they lost the war. And the Confederate only lasted for 4 years. We were 8 years free during Reconstruction. And so our people know what it feels like to fight. And we are owed at least double the amount of time and the infrastructure that the Daughters of the Confederacy received. From federal planning, they've gotten grants, they've gotten all kind of stuff. So we're building out a strategy that's both a policy, advocacy, but also narrative, research, because we are owed, and we are here to fight for justice for all people and not to just harm and blame and shame. So that's it.
I love you, Dr. Joya. I love that. Daughters of the Reconstruction. That's how we change the narrative. I love it. So I'll just uplift 2 things briefly. One is for National Black Midwives Alliance. We are working on establishing a Black Midwives Day, which will be celebrated for the first time next year, March 14th. So I'm going to just put a link in the chat to Petition, change.org petition to establish the National Black Midwives Day. We need a day to honor the history of Black midwives and the need for more Black midwives, and that Black midwifery is key to solving the maternal health crisis, including access to abortion. So that's the first one. And I think also part of how we address this crisis, we think outside the box, we're innovative, we do new things. And so we are working on developing a birth justice app at Southern Birth Justice Network that will be a resource for all pregnant people. And I would love your input. So all of you who are in the profession or have had a baby or have ever known someone who was pregnant or supported them, we need your information and your perspectives on what's going to be important to be included in this app. So I'm going to drop the link for a very short survey, which will take you about 5-10 minutes to complete so that we can have your input. So thank you.
I'll be really honest, at Feminist Center, we're working hard to plan for the immediate aftermath of the Supreme Court decision that's anticipated at the end of June or sooner. We, again, provide abortion services up to the legal gestational limit in Georgia currently, and are also a plaintiff in the challenge against the 6-week ban that was passed in 2019. And so all of our work right now is trying to ensure that we can continue to provide compassionate abortion services for as long as possible to everyone who needs them, in addition to continuing to expand our wellness care, our gender affirming care, our contraceptive and preventative services. So what I would recommend to folks, if you're interested in supporting local independent providers, find out where the local independent clinics are in your community. If you are not in need of abortion care in the immediate future, but you might need a pap smear, consider getting your wellness services from an independent provider that will help clinics like us to be able to sustain ourselves into the long term. Support your local abortion funds. Abortion funds are going to be critical in this moment. They have always been one of the lifelines that allow for people to get the care and the practical support they need to get abortions, and that is only going to increase when so many states are negatively affected by the Supreme Court decision. And the last thing I'll say is, while there certainly is always a lot of attention that is pulled into the federal level election cycles, I would encourage people to connect with the local elections, the local positions and ballot initiatives that are happening where they live. We have so much potential for real sustainable change at the local level. Some of the worst abortion restrictions and attacks on our rights more generally are being birthed out of the states. And so those are the places where we need to be doubling and tripling down on our energy. There may be judges on your ballot, there may be attorneys on your ballot, there may be sheriffs on your ballot that will also be connected to what's happening around reproductive justice. So just, you know, local clinics, local funds, local elections is going to be my calling card for the foreseeable future.
Absolutely. And just to uplift what Kwajalein just said, she's at the Feminist Women's Health Center, and that's feministcenter.org, I believe. So please support them in their work. That's all for our time. I want to be sure to let you all know that we do have at Black Mamas Matter Alliance, we do have our early bird registration is still opened until June 30th for our Black Maternal Health Conference and Training Institute that will be happening in DC, but then also virtually. So please visit our website there and continue to follow us on all of our social media platforms. You can access the recording to this webinar and other publications and resources on our website at blackmamasmatter.org. Thank you so very much for your time, for your work, for your leadership, for your unapologetic advocacy, your scholarship, everything that you have given to this work around just saving, healing, and liberating our communities across this country and even globally. Thank you to each and every one of our panelists today. And thank you to all of our audience. Thank you so much for sticking with us. Again, this recording will be on our website. Thank you all. Have a blessed rest of your week. Have a good one. Thank you.